Hey, that changes.
Hi guys, welcome back to my channel. This is Lawful Beauty checking in. So today's video is going to be about Lasik surgery and my experience with it. It's been about a week since I've had the surgery. I'm going to come in a little closer for you. All the redness that was originally on my eyes is like very minimal, and I haven't had any issues as far as like with my vision. I actually want to say, like, it's crazy going from glasses to nothing at all, because I always feel like I have my glasses on and I'm always like tempted to like either try to push my glasses off or like take them off before bedtime or whatever. But honestly, it is like seeing HD for the first time without my glasses. I don't know what it is, but my vision actually improved. So after the surgery, you go back either 1 or 2 days later so that they can check your vision, and you do the standard eye test. My vision is actually at a 2015, which is better than 2020, which I was seeing before. And I can tell the difference. It's like going from a 1080p to a HD television, ultra 4K. All right, so I'm just gonna go over a couple questions that like everyone has been asking me, whether it's, you know, through my Facebook, social media, texting me, or in person. First thing that everyone wants to know about is the price of the surgery. So when you go in for your consultation, they'll give you the quotes for the different types of lasers. They do have a less expensive option and they have a more expensive option. Basically, how it's explained to me is the only difference between the two is one option has a 2-year warranty and the other option has a 4-year, a lifetime warranty. So for the 2-year warranty, the price was $1,470 per eye, which is with the medications and everything, the eye drops that they give you. That's $3,060.95. Okay, now for the more expensive option, what gives you the lifetime warranty, is at $2,295 per eye. Yes, that is very expensive, but I didn't pay that price because during the time they have different promotions, and I do have eye insurance through my job, which covers 15% of the procedure if I was to use the less expensive version. But because they had a better deal than using my insurance for the lifetime warranty option, which I chose, I was able to get $1,000 off. So they brought it down from the $4,710 to $3,713. However, if you work for a company that has like a health savings account or some kind of account where you can use towards your medical expenses, you're able to use that. So I actually paid for more than half my surgery with my benefits from my job, and I only had to come out of pocket like $1,700. Now, if that's still too much for you and it's too expensive, they do have a payment plan that you can set up, and it's the standard thing you apply. It's based on your credit, interest rates, and everything like that. But you can choose the 1 year, 2 year, 3 years, or how many ever years to make your payments a little bit lower to work with your budget. They're really good about that. They just ask that you inform them like 72 hours before your surgery if you want to do the budget-friendly option, okay? Now with that, they're very good about going over all the details of the surgery. So when you first start thinking about it, you would call the company. And I did a lot of research, and I chose this area because, one, I knew someone that had the procedure done there, and they also went with my insurance company to help me out with the cost. So mine was done in Schaumburg, Illinois, and 999 Plaza Drive is the address. It's called Lasik Plus. This doctor came highly recommended. He's been doing it for 30+ years. I went through like all the reviews. I didn't see any negative reviews. He himself had it. He has done it on people in his family, and pretty much everybody in the clinic when I went for my consultation either had it done or were going to get it done. So I wasn't nervous about this doctor. That's one thing you want to make sure you do, is just research which doctor you're going to go to, how often they perform this surgery, how long have they been doing it. you know, all of those things that may be important to you. So then the next question is, that people have been asking is, what all do you have to take for your eyes? Like, I don't have much redness now, but I think I took a photo, and I'll upload that photo to the video to show you what my eyes look like. They're getting so much better. They're less irritated. Like, actually, I'm so surprised that all this was bloodshot red earlier this week, and I'm like so surprised that it's totally gone almost. All right, so you get three types of drops that you get with this. So the first drop that you have to take, and you take this one. All right, so you get 3 types of drops. This one is the antibiotic for your eyes. You have to take this one 4 times a day, and it's usually for 10 days or until it runs out. Mine is almost gone, so I probably won't even use it for the 10 days. I think mine's going to be gone by tomorrow. And then the second one that you have to take is this one. And these are just, it's a second type of antibiotic for your eye, but it also helps with the dry eyes, because that's one of the side effects of the surgery itself, is that you could get dry eyes, which is an irritation. Anybody that wear contacts, and you know how it feels for them to dry out, that's how your eyes feel when they dry out themselves and you don't have anything in it. So these help with that, but you only have to take these twice a day, in the morning time and at night. And then they give you a couple boxes of these, and you can actually buy these over the counter if you need to. These are just like sterile drops that you put in your eye to help with the lubrication. It's the same thing, it's just you use this one throughout the day. They recommend 4 to 6 drops, or as often as you need it. Everyone's eyes are different, so you might not need it as much. Me, I don't feel like I have a lot of dryness, so I use these when I feel like my eyes are getting a little irritated, but I've just been doing the 4 to 6 drops just because that's the recommendation. And these 2 are for 30 days, so for the first month, I'll continue taking these as need be, but these are day and night. And the fourth thing that they give you are like these, I guess, Hydro Eye gel capsules. So you have to take 4 of these a day, and this is just a pill formula to help with the dry eyes and symptoms. Basically, I read the ingredients in this, and this is just pretty much like a supplement. It has vitamin A, vitamin E, vitamin C, vitamin B6, magnesium a little bit, omega-3 fatty acids, black currant seed oil. So that's pretty much all the ingredients in there, and this one just helps your eyes heal a little bit faster, and it gives you all the vitamins that you need to help with the dryness in your eyes. So for me, honestly, I haven't had a bad experience with the dry eyes. So for me personally, it hasn't been a big issue. Every now and again, yes, my eyes do get a little dry, and I just put the drops in there, and then I'm fine. It's nothing major, nothing that would make me be like, oh, I wish I didn't get the surgery. Okay, so the next question that is asked of me is about the surgery itself. So the surgery was very quick. Honestly, it tells you on the paperwork, when you get the paperwork, that you'll be in there for 2 hours. I don't even think I was in there for an hour. You go in, you fill out your paperwork, they let you see the videos of the procedure, you make your payment. If you want the pain medication at that point, they administer the pain medication, which my office offered Valium and Ambien. I'm not big on medication itself, so I declined. So I don't know about the side effects, and I'll tell you in a second about what the Ambien is for. So I don't like pain medication. I had a bad experience when I got my molars removed, like when I was in high school, and they made me really sick. I had Vicodin, and that did not go well for me. So I always opt out of the pain medications, and I just deal with whatever I have to deal with. But if you're one of those people where you may freak out and it may make you a little nervous, then you're more than welcome to get them, and there's no extra charge for that. So the day of the surgery, I went in. You do have to have someone take you and to drive you home because you're not going to be able to drive after the surgery. So you go in, they put these numbing drops in your eyes. You wait about 10 to 15 minutes, and then you go into the room with the doctor. Then when you get in there, the doctor tells you, he like walks you through the entire process. There was 2 different machines that I got on. The first one was to open up the I guess the flaps is what they call them. The flaps, so that makes the cut in your eye to help you to be able to see a little bit better. That one, it's like you're laying down, you cover, one eye is covered, and then you look at this little dot and it comes down. And he's like, and he talks to you. The doctor is literally like 5 seconds per eye, and he's talking to you the entire time. He's like, you're going to go blind for a little bit, and you do lose vision, which can be a little scary, but just stay calm, and it comes right back. It's a split second. It's like you close your eyes and then open them back up. It was like that. So they do that for both eyes, and then they put you on another table, which has the laser, and there's like this little machine. So there are like these little white lines that go in a circle, and then there's 2 red dots on the side that you can see on your peripherals. And then there's a green dot right in the center. And they'll tell you, look up and focus on that green dot. So while you're focusing on that green dot, that's when, and they give you some more numbing drops throughout this. And then they put this little, I don't even know, it's some kind of tool that pretty much holds your eyes open, and it sucks. It'll hold your eyelids open, and it lets the doctor control your eye. So they tell you to stay very still, just remain calm. They told me I was doing very good. I just sat there. I didn't move because I didn't want anything to mess up. But they reassure you. One thing that I learned was the laser machine is designed to automatically shut off if you blink, if you move, or anything else that's going on in the eye that it can't detect. So for me, actually, I had my hair up in a bun when I first went, because you have to put on like this little cap, but it was causing too much friction with the laser, so they had to actually put my hair and just pull it to the side so that I could lay flat enough for the laser to be able to detect it. So that's how you know, like, and then the doctor will tell you, focus on that green light, and he's like, let me control the eye, and you just relax, and you hear this sound. And you just look up at that green light, and while you're looking up at the green light, he'll tell you like 15 seconds, and the laser's going. Now, while this laser is going, it's making a sound, and you smell a little burning. I guess it smells like kind of like burnt hair. And they tell you, like, don't freak out, because that's the laser doing its job. So there's nothing wrong. Everything's going okay. So after that, it was like 15 seconds per eye. Boom, boom. You're done. That's it. You get up. They take the things out your eye. You're good. They take a picture with you. You're able to see. It's a little blurry. You don't see very well. And so they put some more drops in your eye before you leave, and then they give you your sunglasses, and you're free to go. And they tell you for the next 4 to 6 hours, it's very important that you either go to sleep or you have to keep your eyes closed. Now that's when the Ambien comes in, because they tell you so that you won't be messing with your eyeballs or anything like that. They tell you to go to sleep. For me, I didn't opt in for the Ambien, and I kind of wish that I did, because it was hard for me to fall asleep, so I felt everything. I'm going to give you the 100% truth, because I'm not going to sugarcoat it for any company, okay? After the surgery, I kept my eyes closed. Like, on the ride home, I kept my eyes closed. When I got home, I got straight in the bed. I kept my eyes closed, and I just tried to fall asleep, but I couldn't fall asleep at first. So the feeling, let me see. I described the feeling in my eyes was, it felt like someone was taking their nails and just consistently scratching at my eyes. It was like a burning sensation. Like, it did not feel good at all. And it was just like not pleasant to have to go through. And I was like in the room, just so uncomfortable. Eventually, I took some Tylenol PM, and that helped, and I was able to fall asleep for the remainder of the time. I set my alarm, so I made sure it was exactly 6 hours. They recommend 4 to 6, so I just did 6 just to be on the safe side. And then after that 6 hours, I was up, and as soon as I opened my eyes, I was able to see. The pain was gone away. It didn't hurt anymore after that 6 hours. I guess my eyes adjusted to it and everything like that. So then after that 6 hours, you start your drops. That's when you start a couple of drops, and they give you instructions on which drops to take at what time. You don't take all 4 on the very first day. You don't start 2 of them until the next day. You just start, and they give you like an instruction sheet. It pretty much looks like that, and it just goes over on that, and it just tells you. And then even on the back of this sheet, it gave me like all the after treatment and everything like that. So for the very first week, you have to be really delicate with your eyes. So I haven't been able to wear makeup for the last week because they tell you let your eyes heal, no pulling at it. So I actually haven't been able to do my regular skincare routine to the best that I could normally. But I can't wait because starting tomorrow, I'm gonna go back to my regular skincare routine. And you can start wearing eye makeup. I could start wearing eye makeup as of today. I just haven't put on anything. I just wanted to give it an extra day just to give it a little cushion. But they tell you don't touch pretty much this area of the eye. So I know it was hard for me because I'm like, well, putting those drops in at night, you know, you get the little eye coal or whatever they call it in your eye, and I'm like, how am I supposed to clean that? So I'm like, I'm not about to walk around here looking like that all day. So what they told me was I can put the drops in, and then you just take a little Q-tip and you just be real gentle. And for me, it was easy because if you do any kind of eye makeup or if you are sensitive in the eyes, you know to just be gentle. And I didn't have any problems. I just would do my Q-tips. And what I did was I put a little baggie, took a little baggie to work with me, and I'll put my eye drops and Q-tips in that. So like if I needed to. Now for recovery, every person is different. So everyone's recovery time will be a little bit different. Some may be shorter, some may be longer. And then depending on the line of work that you do, it might not be recommended. So for me, I had to take 3 days off of work, which the doctor recommended based on my job duties and what I do. I use my eyes all the time, and I'm constantly looking at computers, and I'm all out and outside, and stuff can get in my eyes, and you never know with me, if something happens, I could be in an all-out fight and somebody could hit me in the eye. So I took 3 days off, and that was because the first 2 days, it was uncomfortable. Like, I couldn't look for long periods of time. My eyes would get a little tired. When I went outside the very first day, I had a real bad halo effect. Like, I could not see at nighttime because of the halo effect, but that it's better now. Like, I have no problem like seeing at nighttime now, and they tell you that's normal. Your eyes are still adjusting. It takes actually 30 to 90 days for your eyes to fully adjust and for your vision to be at its best. So throughout the next couple months, my vision will still continually get better and finally even out. It goes over there. I couldn't get in a sauna. I couldn't go swimming or hot tubs for a week. It tells you to not rub your eyes. I still can't rub my eyes. So, you know, people that have that real bad thing to just like do all that or do whatever to the eyes, it tells you not to do that for 3 months. Because like I said, your eyes are still healing. Like, even though I can see I'm fine, they're still healing because they created this flap. From what they explained to me, they created a flap to help me see that better. And then let me see. You do have post-op visits. For me, I had one a couple days after my surgery. I have one actually in a couple weeks. And then once I go to that one, they'll re-examine the eyes. And this is all part of your initial payment. You don't have to continue to pay to go and get your eyes checked. You have all of this is covered under the plan. So They're constantly checking to make sure nothing's going wrong. They make sure that it healed properly, that you don't need extra medication. It's not like you go and they leave you out to dry. No, you go, they do the follow-up, and they pretty much take care of you as far as your vision for however long that may be. Let's see. Any other thing? No, that's it. That is pretty much. As far as my opinion, I would say I had a really good experience, regardless of the minor pain and for the first couple 3 days that I experienced. It's well worth it. Like, it's no greater feeling being able to wake up and be like, whew, I could just see. Like I told I tell everybody, like, it's crazy because I really do feel like everything is in high definition now. Like, when I used to wear my glasses, it was just not the same. And I'm really excited, and I can't wait to explore and see what I can do with these new eyes.